All right, everyone. Well, once again, good afternoon, and thank you for joining today's HI Office Hours session. I am Sydney Reichert Jensen, MyHealth's Marketing and Communications Coordinator here at MyHealth, and I will be your host for today. So we're glad you've joined us as we dive into today's session on MyHealth's Care Gap Reporting product. So as we kick off today, I have a few reminders for everyone. First, panelists, please mute yourself when you're not actively speaking. Secondly, attendees are automatically muted in the webinar. So to ask a question, please use the Q&A or the chat function. And then today's presentation will be sent out to all attendees after the session in a PDF format. A few OK Shine program reminders. I just want to touch on the fact that our Connection Fee Assistance Program covers all one-time MyHealth connection fees for organizations employing licensed providers in Oklahoma, making it easy and affordable to connect to the state-designated HIE MyHealth. Additional related fees may also be covered, and applying is quick and easy at okshine.gov. And the Sooner Select Provider Incentive Program offers up to a 28% increase in reimbursements for qualifying care, 18.5% for Sooner Select participation, and an extra 9.25% for those sending data to the HIE. These are powerful opportunities to boost both care quality and financial return. Application links are in the chat and will be in the follow-up email PDF version of this presentation. You can also visit MyHealth's website at myhealthaccess.net for more information. All right, getting into today's presentation. Joining us today are Katie Decker and Kat Cunningham from MyHealth Access Network. Katie is the Director of Clinical Informatics and Product Manager for our Care Gap Reporting solution. With more than 15 years of experience aligning clinical workflows, population health needs, and technology to support value-based care. She's joined today by Kat Cunningham, Product Owner at MyHealth, who leads the Care Gap Reporting product. Kat brings nearly a decade of experience in customer service and product management, translating user needs into effective product solutions. Together, they'll share insights on MyHealth's Care Gap Reporting. So with that, Katie and Kat, I'll hand it over to you.
Thank you, Sid. All right, we'll just jump right in. So today I'll be sharing with you about our as Sid said, about our Care Gap Reporting product. And the primary goal of my presentation today is that you walk away with an understanding of the product and the value it could bring to your organization. So I wanted to lead off, and these slides may look familiar to some of you, but I wanted to lead off with some data around the problem with which we are trying to help improve from a macro perspective. So again, these stats are likely familiar to you, but as you can see, Oklahomans rank near the bottom in healthcare quality, with among the highest healthcare costs in the nation. And this slide just highlights some opportunities where we can make an impact on these health outcomes and costs. So MyHealth aims to support solving these challenges by securely uniting patient records from different systems, ensuring providers have a complete picture of a patient's medical history, which leads to safer, more efficient care. We have a variety of tools that facilitate opportunities to make an impact in these areas, but Care Gap Reporting in particular provides a way for our participants to proactively engage patients and members, particularly in preventative care. So what is Care Gap Reporting? Care Gap Reporting product is a tool that highlights missed or overdue care by analyzing the most up-to-date patient data across that we receive from our participants. So each month, the report uses data, again, from across providers and payers and systems to show the most recent clinical events for every patient. And providers aren't just relying on their own records, they're able to see the bigger picture of a patient's care. So how does it work? We ingest data, clinical data into the HIE. You can see this data if you're logging into the provider portal. And we also have attribution of members. So if you elect this product, you can choose a particular population that you might want to receive a report on. And so we have attribution of whoever that roster of members or patients would be. And then we share that report monthly with, again, those most recent events relevant to whatever value set your organization has selected to receive information against or on. And then the providers or payers or whoever is receiving these reports are able to take action, provide outreach to their members or patients, and document and close that feedback loop. So with these insights, providers can identify overdue screenings, missed immunizations, unmanaged chronic conditions, and this can really empower the care team to take action quickly and improve patient outcomes. All right, so what does it look like? The care gap report provides patient level detail from multiple data sources. So each report is delivered monthly, or most people choose to receive it monthly. And again, that includes the most recent clinical events available for every measure that would apply to your selected value sets. So because this report is cumulative, the providers or payers or anyone receiving the report has the latest information, not just activity from a single month. So we are looking back over all of the historical data that we have for that patient or member. And this structure makes it possible to track preventative and chronic care consistently over time. So this is just kind of a rough snapshot that the care gap report provides. Again, that patient level information, which you can see here. And this includes details such as the patient's primary care provider, the value sets used to measure care quality, the dates and results of care gap related events, any provider that might have been engaged with that event that we are providing information on. I think this is particularly valuable for people who are receiving, for those that elect to have value sets related to blood pressure and A1Cs, some of that supplemental data you're not going to see come across on a claim. That is really something you have to access, maybe a patient record and that clinical data to receive. We're able to surface that in these reports for you. And by bringing this information together, again, the report offers a complete view of the patient's care history. So not just organization by organization, but overall, based on their comprehensive record. So providers can quickly see what has been completed and then what may still be missing, which helps guide the next steps in patient care and outreach. So why is this valuable? We've talked, I've spoken to that in previous slides, but I think it really helps identify or narrow down kind of missed or overdue care so that you can, if you're receiving these reports, you can see what care has occurred and then spend your time focusing on the population that has not received, the outreach or the screenings, immunizations, whatever the, care might be, but really focusing on those that have not received the care that or follow-up that you have intended. So I think this allows for a reduction in, administrative burden by care teams if you can really focus rather than, if you're trying to outreach to an entire population of people to get them in for follow-up appointments. This report allows you to really focus on those that have not been seen rather than casting a broader net that may not be necessary. So again, value for providers, it is that single source for all of your attributed patients. So you don't have to reconcile multiple payer reports or reconcile against multiple sources of information. It's just all available in one location in this report. This also facilitates, for those of you that are involved in value-based contracts, this provides a tool to facilitate success in those contracts as well. And then on the health plan, for the payer side, this report provides an opportunity to improve quality scores across the population level and support reporting requirements and engagement with provider partners. So for those of you familiar with quality measures, HEDIS is a commonly used set of value sets. So that might ring familiar to many of you, but you can probably imagine the different use cases where this could be beneficial. So a couple different examples just to call out, diabetes management for those members that, when you need to get in for eye exams, A1Cs, this care gap reporting can provide the information needed to make sure your patients with diabetes are receiving the preventative or regular care that they require. Well child visits, so tracking on preventative care, immunizations, also medication adherence, so identifying patients with missed medications, cancer screening, particularly important for the preventative care aspects. So specifically, colorectal screenings. So we have data back, at least 10 years on many members and patients. So we can see if they've had a colonoscopy in that 10-year period. And then this slide is just a little bit more specific example of how the care gap report can be beneficial. So this is, for our specialist providers. So from an ophthalmologist perspective, and also really primary care providers. So if you think about a patient that has type 1 diabetes, in this particular instance, this patient was overdue for her annual diabetic eye exam. And so that was visible in that care gap report that the practice received. And so then they were able to reach out to that member or patient and go ahead and get her scheduled for an appointment. So just some stats to highlight so far this year that we're really proud of. We have delivered 60 care gap reports in 2025 so far, and continue to grow on our product delivery for care gap reporting. Average patients per report, 500,000 patients, that's a lot. So again, really proud of those statistics and the potential impact we're having on patient care. Average records per report, almost 3 million. So these are large reports with lots of, because we do have such comprehensive data on patients and members. And then reports are being delivered, what is the breadth of our delivery? We're really delivering these reports statewide to practices and other organizations. All right, so how providers are using care gap reports. So providers are using, it really depends on the practice, but providers are using care gap reports in several important ways. So adoption continues to grow across organizations statewide, reflecting the value of the product. So in practice, providers can use care gap reports to improve, again, quality scores, particularly if they're involved in those value-based care agreements. Can be used to enhance patient outcomes through timely interventions. I know many care management teams or value-based care teams in larger organizations are using these reports for that purpose. So it's really a tool that benefits both patient care and organizational efficiency. And then just to further highlight how care gap reporting supports value-based care payment models. And provide support in several key ways. I think first, again, improves performance on quality measures that are directly tied to reimbursement. It also reduces, as I spoke to earlier, administrative burden. So it's, kind of providing a targeted list of members or patients that could benefit from outreach. And then finally, it enables timely interventions that improve patient outcomes while lowering costs altogether. So these areas really make care gap reporting a strong foundation for thriving in value-based care models. And ultimately, care gap reporting facilitates the goals of Healthcare Authority's quality improvement department and the IHI's quintuple aim by providing a tool that can help improve care, lower costs of care, improve population health, advance health equity, and improve patient or member and provider experience. And so the next couple slides are just frequently asked questions that we get. And if anyone is interested in receiving the care gap reporting product, I'd be glad to go over any of this information in greater detail with you, but just to highlight some of the most common questions that we receive. So are the reports cumulative? Yes. So each month, again, you're getting the most recent or information on the most recent clinical events that have occurred on your patient or member. So it's not just the clinical information that has occurred in the last 30 days. And then another question that we get is, how is the information generated? So if you are, again, a user of our portal, you can see when you log in at the patient level or member level, you can see, all historical information from all the organizations that have a record of care on a particular patient or member. So our system processes that aggregated clinical encounter data and then applies the value sets that you specify and uses that to generate the reports each month. And then up to this point, all of our customers have elected to receive the reports on a monthly basis. That is something that I think, if you had a need to receive more frequently, that's something that we could certainly discuss, but monthly seems to be kind of the right time frame for our customers again up to this point. And then you can access the reports within your organization. So when the reports are delivered, we work with each organization at the time product election and rollout, but we work with each organization to determine the secure delivery location. So many organizations are receiving the files to a secure SFTP folder, and then the organization processes them from that point. Another common question, do the reports include claims data? So they do not. This is all clinical data, just like what you're seeing in the provider report or portal right now. And I think this is important because the clinical data is so valuable, because it allows for capture of some of that supplemental data, like the blood pressure readings and the A1Cs that you would not get with claims data. So having the clinical data really provides the more complete picture of patient care. And then, can the reports be customized for different populations? Yes. So the population that you would receive the care gap report on would be specific to whatever your preference is. And to define that, we just need a monthly roster that you would provide, and that we will generate those reports based on that population that you desire. And then, how quickly after data is submitted does it appear in the reports? So of course we're delivering on a monthly basis, but and I'm so sorry if you can hear my puppy in the background. She's running in my office. So apologies if you're hearing that noise in the background, but The reports include the most recent clinical events available in the system. So again, we're seeing those come through in near real time, and then updating our reports that get generated on a monthly basis with that information. All right, and so what's next? What's on our roadmap for this particular product? So we're very excited. I think one of the most significant efforts underway is we're in the process of going through an analytics environment upgrade, and this upgrade will give us the ability to create report enhancements to the existing product more quickly. The ability will allow us to query large data sets more efficiently and more easily introduce advanced analytics capabilities going forward. So very excited about that. And that should be complete, again, prior to the end of 2025. And then with that update, we're also expanding some of the specialist the MPI information that is provided in the report. So if you are currently receiving the care gap report, you will begin to see, if not already, more MPIs and provider information coming through. And then I think I spoke to the ability to make enhancements and new feature, make enhancements more quickly once our analytics environment upgrade is complete. So as you know, if you're receiving the care gap report and you have maybe kind of some more custom needs or population health reporting needs, it will be easier for us to more quickly kind of work with you on delivering more enhanced report types. All right, what questions? Anything in the chat? All right. Kat, did I leave anything out?
Nope, thought you covered everything.
You just did such a great job, Katie. There's no need for questions.
I'm so sorry about my dog in the back.
No, it adds character.
Desperately trying to get in my office.
No, it's great. We all know what it's like. Okay. All right. Well, if there's no additional questions, thank you guys for your time. We appreciate you tuning in today to listen to Katie on MyHealth's Care Gap Reporting product. Again, you will be receiving an email from us soon that will include a PDF copy of today's presentation, along with additional information on upcoming HI office hours sessions and an opportunity for you to provide feedback on today's session. So thank you for your time and participation. If you have any further questions, don't hesitate to reach out or again, ask them in that survey, and enjoy the rest of your Wednesday.
Oh,
Bye.
Sid, I'm so sorry. One question did come in a minute ago.
Okay.
It just says, so the reports can be customized based on the roster we provide. And then so we can request these reports based on the payer roster.
Yeah, so if I'm understanding the question, if you have a particular group of patients, like a group of patients that belong to one of your payer populations, we can customize the reports to that population. We just need that defined in whatever roster you provide. Does that answer the question?
Yes, I think so. It was posted in the chat.
Gotcha. It looks like it came through anonymously, so it didn't give us a notification, so I apologize for that. Thank you for bringing it to our attention, Kat. Appreciate it. All right. There's no additional questions, though. Thank you all. Enjoy the rest of your day.